Ankylosing spondylitis, or inflammatory spine disease, or in the old days they called it rheumatoid spondyloarthritis, is a not uncommon condition. Mostly young men get back pain in the mornings, and it starts from sacroiliac joints and ascends in the spine. These two are the sacroiliac joints, and then you see on either side. The best way to evaluate this is to compress the sacroiliac joint, and you detect a painful area. However, nowadays we do MRI, a CAT scan, and X-rays with a specific angulation to check for this spinal arthritis here, which starts with sacroiliac joints and gradually ascends in the spine until the entire spine becomes one piece, like what we call a bamboo spine. We see this more commonly spontaneous, but sometimes after an infection and dysentery, like Montezuma's Revenge, can initiate this, an inflammatory arthritis, long after the diarrhea is gone, or other kinds of infection. Today I saw a patient that is reportable. It's for the first time I saw this. A young man that had no symptoms. He went for a job and he was staying out of town in a hotel, and he had 50 bed bug bites. These bites became infected and was associated with cellulitis, to the point that he ended up in the hospital getting intravenous antibiotics. Immediately after that, he developed foot pain, ankle pain, and also sacroiliac pain. In other words, he had a reactive arthritis after a bedbug infection, which is reportable. I don't believe I've ever seen it reported. However, when I worked him up and I did his lab reports on his studies, he was noted to have an elevated inflammatory markers, and his HLA-B27, which is a gene on chromosome number 6 that is seen in 5% of the normal population, was positive. However, in people with reactive arthritis, ankylosing spondylitis, and psoriatic arthritis is a lot more common. So his disease was initiated with an infectious disease, and otherwise he would not have had any problems for the rest of his life. This has become, in his case, not even a management problem. It has become a medical legal issue. His management so far is included non-steroidal anti-inflammatory agents, and also addition of sulfasalazine. The disease has two-pronged inflammation, with treatment must be two-pronged approach for the treatment. We'll cover this item in the future videos.